the thing that's most alarming with zero figures reported is the fact that I think, given our status as a developing country and the stage in which we've handled COVID already, I think we need to think more towards not the fact that COVID is no longer here, but whether or not we're doing enough to detect COVID within the population. So right now I would have to say that it has a lot to do with the lack of testing in the population, and so that's quite alarming given the emergence of these new strains like Delta and Delta Plus. For all intents and purposes, I think the figures of zero are very misleading indeed.
Yeah, so do you believe, at least anecdotally, that the virus is out there and it is circulating throughout the country?
Oh, most definitely. Even when we were in our first surge and our second surge, I do think there was terrible underreporting. And now that we are looking at possibly a third wave of infection, you really have to wonder what is the real situation out there in the population when, for all intents and purposes, testing is really only done in the major centers. And if you look at Leh is the second biggest city, or more like town, in Papua New Guinea, and our testing is virtually nil. I mean, I'll give you a case of our current COVID center. We have had 0 patients admitted to it for more than 2 weeks now, which, again, says very little about a lack of COVID cases, but says a lot about a lack of testing and detection in the population.
So what do you put it down to? Not just the low testing numbers, but the low hospitalization numbers, as you've just mentioned?
Almost the buck starts and ends with the government. The government is not doing all it can, given the amount of money that has already come for COVID, that being in the vicinity of more than 5 billion kina. And so with what's on the ground at the moment, you really have to worry about where this money has gone and why there isn't more effort being done to figure out how much COVID there is in the population and then go about handling it in a manner that is in keeping with how the rest of the world is doing it.
You spoke about the Delta variant, and we are seeing that explode, I suppose, in Indonesia, but also in Fiji, another record daily rise there again. How concerning is it to you that the Delta variant can spread potentially in Papua New Guinea?
Even before the emergence of the Delta variant in Indonesia and in Fiji, the World Health Organization simulation, and these simulations that we would possibly have a third wave in the end of July, August or September. And with the emergence of the Delta strain in Fiji, and then of course Indonesia, we share a land border with Indonesia, you have to think that it is not if, but when it comes to our border, our country. And given the current situation, I'm not sure if we're ready to receive it, if receive is the right word.
And what about the vaccines themselves? How are Papua New Guineans perceiving the two main brands of vaccine, AstraZeneca, and further down the line, perhaps Sinovac from China that's yet to be approved yet?
The unfortunate truth is that the layman's perception of the vaccine is that there's some kind of medicine inside that will maybe make you infertile, or there was a rumor going around for quite a while that there was a microchip implanted in the vaccine. And all of these sorts of rumors, they're perpetuated on social media through TikTok and Facebook and Instagram, and then shared amongst groups, individuals, and the reach is far and wide in this country. And the ability for people to look at something and not then go out and try to get to the bottom of it and only see things at face value is one of the terrible truths in understanding why a lot of our population is skeptical. And so this again comes back to that point of the government needing to go out and tell people that all of these things that you see are not true, and this is the actual evidence available, and continue to put it in the public sphere. If say, for instance, now you look at the dailies, there's very little reporting on COVID-19 and the relevance of why we need to be more proactive with it. Again, this is a failure of our government to really push the agenda and what we need to do going forward with vaccination attempts amongst the population. So we can blame the population for ignorance, but the government must be firm in going about changing that opinion.
Okay, Dr. Alfred Mel, good to get your thoughts on this. Thanks very much and all the best.
Thank you very much, Garish, and good night.